Welcome back to Inside Southern California. I'm Bruce W. Cook. Our show is about, do you look how you feel? Are you happy with your appearance? Would you consult a plastic surgeon to improve it? Our guest, Dr. Paul Chasin, one of the most respected doctors in Southern California, an expert in plastic and reconstructive surgery. Paul, people come to you and they say, change my life, change my look. How dramatic is it? How has it changed over the last few years?
Well, it can be from very minimal to dramatic. We see a huge spectrum of people. Lately, there's always trends in our field, but the latest trend has been people who have been out of work or they're going back to work, and they're investing in themselves. They're getting either from something as minimal as Botox, just to look a few years younger, to complete facial rejuvenation, and being able to use that to look better, look younger, and feel more confident and go look for a job.
You know, a few years ago, maybe 10 years ago, experience mattered more than appearance. How do you balance that equation today when someone comes to you that's maybe between 40 and 60 years of age and needs to restart their life and has lost the sense of confidence, maybe because their appearance has sagged, and tell them that, you know, I can take the fat off your chin, I can fix your nose, I can make you look a little younger, but that's not always just enough.
Well, like you said, you know, you see yourself maybe 20 years younger, but then you see yourself in a picture or a photo from the side that you normally don't see, and you say, oh my God, what's that? And I don't see that. And I think sometimes that's a sentinel moment for people. I think that in today's world, especially in Southern California, there's just biotech and internet and computer-based companies where people who, even though they're experienced and in all fairness might do a better job, are competing against people who are much younger, who understand that space just as well. And so when they're competing with that group of people, how do you compete if your knowledge base is the same, but you look old?
Exactly. It's like that Just for Men hair commercial where the guy with the beard has the gray and the other guy doesn't, and they say, well, he's got the experience and he's got the energy. Today's world, we have to have both going for us or we're out of luck.
Right or wrong, it's a visual world. Now, fortunately, in my field, looking a little gray is good, but in other fields, it's not as good.
Exactly. Nobody wants a doctor that just stepped out of medical school that only has done one procedure.
That's right. And, you know, most fields are going to be experience-based, and plastic surgery is no exception. Experience is huge. In your field, experience is huge, but how can you find that balance about having that experience and still looking vigorous?
Well, in my field, the only thing that counts is big boobs and blonde hair, which tells you where I stand. But of course, that's your business, big boobs and blonde hair.
Yeah.
Women versus men. Mostly women still doing plastic surgery, but men are increasing. More men are coming to see doctors like yourself.
You know, I saw that trend change about 5 to 8 years ago. I'd say at least 20% of my patients are men.
Okay, give me an example of a guy that comes into you. You obviously don't have to name any names. Joe Blow comes into you and says, help me, doctor.
Okay. I just recently saw a guy, I think he might even be on a picture here on this interview. And he's a fundraiser, a director of one of the arts in town. He had a very full neck. It made him look, not only did it make him look older, it made him look heavy. And he really wasn't that heavy. And we did a liposuction in that area.
We got the picture up. Here we go.
That's him. And maybe, yeah, there you go. So look at the guy on the left and look at the guy on the right, the before and after. And his surgery took all of about just a little over an hour. We removed all the fat on top of what's called the platysma muscle. Then typically men have, that's this muscle when you show your lower teeth, those bands. Under that muscle, they'll have a little nugget of fat. So I'll remove that nugget of fat and then suture the muscles together. And that's what gives a very defined neck in men. And in him, he looks much more youthful, and he looks better.
It does make a huge difference. As a matter of fact, after the show, can we go in the hall? Do you have your equipment with you? I think that I need that myself right here.
Oh, okay. We'll work on that.
We'll work on that. I have to tell you, I know that to be true. I have a friend that had that exact same situation, and he looks 10 years younger from having that procedure. So without giving you a commercial, I have to say it absolutely is true. It makes a difference.
Yeah.
It makes a psychological difference too. This guy that I know that had that done, you know, as all of a sudden his whole personality has perked up. He's much happier, and I think it's a good thing. People don't always agree. A lot of people say it's superficial, it's phony, what do you need to do that for? What do you say to them?
It's not for everybody. It's just not for everybody, but I can tell you that people who feel better about themselves, that when they look in the mirror, they see someone more attractive looking at themselves, their confidence goes up, their self-esteem goes up, their projection to the world is better, and when their projection to the world is better, guess what? The world projects better to themselves. So actually, I would say the vast majority, very high, are very happy, and it's not a complete life changer, but it really does enhance someone's life. And we have someone here today who's going to interview, and you know, it was kind of a life changer for her, and we'll show you in the next segment her before and after pictures.
Before we get to that, and forgive me for bringing this up, but it's something that people say all the time, so I've got to ask the question. There is an entire race is the wrong word, a population, an entire population of middle-aged women who all look the same. They all kind of look like Joan Rivers and Zsa Zsa Gabor, that pulled back kind of almost oriental look. And there's a lot of them in Southern California, maybe not in mid-America, but we're here in Southern California. What is that? I mean, you can tell right away. You can see this person and you say, I know what she's been doing.
Let me address that. Okay, and I can tell you that the development of a relationship with my patients starts with the word no. Okay, I mean, I look at that myself, and it's an embarrassment to what I do, because everything I do should look natural. It shouldn't look pulled or, oh, that person had plastic surgery. There is a huge psychology in what I do, and if you inject someone's lips and you make them a little fuller and they look great, guess what? Well, they say, wow, that looks great. I'm really happy with my fuller lips. I should get them fuller. And so that's where I say, no. I mean, you have to trust me. I'm an objective observer. Do not get your lips any fuller, because that's one of the telltale signs of that in a young person. You know, full lips are okay. Enormous lips look stupid. And so, but you know what? A lot of practitioners are, you know, they want to make money.
They'll do whatever
and
the
they'll
patient
do whatever
asks.
the patient, whether it's aesthetically good or not, they'll do it. And that's why you have to pick your surgeon carefully and develop a relationship.
Before the show, you said to me, Paul, that one of the reasons you chose this as a specialty is because there was an artistic element to it. It was not routine, that every person is different, every face, every nose, every breast is different, and that's what appealed to you. And so it's nice to hear that you do interpret each patient individually and do the best for them, because interestingly enough, in plastic surgery now, as in anything in human existence, trends, people come to you and say, well, Angelina Jolie is the latest trend, and she's got really big lips, so I want those lips. Then all of a sudden, maybe high cheekbones are in, and another celebrity features high cheekbones. So many people have to have that. It's an interesting phenomenon.
Well, that's where the experience comes in. I've been in practice 15 years. I've seen a number of trends come and go. Big breasts were a big trend when Pamela Anderson's day. But now, you know, but then you saw the aftermath of that, of large breasts equal, you know, 5, 8 years later, drooping of the breasts, and then they need a lift. So I almost never do Ds anymore. I coach people to say, hey, listen, a large C, if you want a full breast, stick with a large C. Do not go into the Ds, because you can't hide them. You're going to have problems down the road. You're going to have problems with drooping. So for those are exactly the kinds of things that I can hopefully be a good coach to people and be a good objective observer. And you know, the lips is one of those sticking points that you see all the time. A pulled face is one of two things, either inexpert surgery, because it doesn't take too much to tip. People don't look at a face very critically like I do. They look at a face in a very global way, either attractive or not attractive, young or old. But what makes up that face? If you have an inexpert face lift, which is done just by pulling the skin, tethered earlobes, what we call a swoop in the skin, that pulled look, that windblown look, that's inexpert surgery. That's plain and simple. Or you've had multiple facelifts. I usually tell women they have 3, maybe 4 facelifts in their life, and that's it. Because after the 4th facelift, each time there's a little scar tissue laid down. Each time you pull the skin, you lose some elasticity. So consequently, if somebody starts having facelifts too early, and then they, every wrinkle they want another facelift, and they've had five facelifts by the time they're 60, just like one of my friends said, who's in her late 70s, just because I'm in my late 70s doesn't mean I stop looking at myself. And so that's the problem. They start getting in their 60s, and now they're on their 4th, 5th, 6th facelift. That's when they start looking really bad.
Well, we're not going to let that happen. And as a matter of fact, we're going to take a break and bring out a patient and get specific with her in just 1 minute. Dr. Paul Chazen, it's nice having you on the show. It's interesting stuff. I'm going to be seeing you very shortly after the show myself. Ladies and gentlemen, we're going to take a break. We'll be right back.